it minimally invasive. The success rate for this is about 100% on average for us. We've not had any failures. So again, it's just there is some anatomical variation with people, but for the most part, nice and easy, guys. We're going to go in and target the piriformis muscle attachment to the greater trochanter. Jordan, shot please. Okay, shot. That looks like it. We're going to go in right there, make our incision behind her hip. We're going to go through the soft tissues with a small incision, and we're going to release that piriformis muscle. Any questions? Let's show the audience how this works.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Well, you can see from the animation that people tear their piriformis muscle. The muscle is prone to tearing when you're bending over, picking something up, but twisting at the same time. That twisting and bending over movement will stretch the piriformis, and eventually it will fail. When it fails, it tries to repair itself through a process called inflammation. But the problem is we as humans don't lay still long enough to let that happen. So people end up re-injuring it, and over time, injury after injury after injury to the same muscle, same spot, ends up causing scar tissue, and in that scar tissue are pain nerves, and they are painful. So this is a very painful condition, and I can hear this. You can feel it too, huh, Hector? You can literally feel it. It's like a guitar string. And you can hear it in the operating room, like twang, 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 as we're cutting through these scar tissue bands in the muscle. Now, this is a revolutionary new procedure, and I patented it because I'm the first to develop it. It allows us to do a piriformis release, minimally invasive, without opening the patient up, without bleeding. All right. Any questions from our team or viewers?
No questions.
Which side was bothering her the most, Bernadette? The side I'm on right now. All right, we're just about done. Shot? Any questions you said, Anthony, or no?
No questions.
Well, let's leave the audience with one of our nice patient testimonials from a patient who had this procedure done. I want to show you all, we just finished doing everything that we set out to do. We did it all through what are called 4mm incisions, Band-Aid incisions, all minimally invasive spine surgery. We did the facet joints with 2 small incisions, the SI joints with another 2, and the piriformis with another 2. So she's got 4 times 4 is 8 incisions. Thanks for joining us. There's no questions. Let's share with the audience one of our past patients who had this done and how they did. morning. I'm Dr. Deukmedjian. I'm here with one of my lovely patients who she had some words of wisdom for me this morning. Keep smiling. And you're smiling a lot today.
I am out of pain.
Out of pain, good. So she had a piriformis muscle release done. How do you feel?
Good for morning after.
Yeah,
Good.
feel good.
Ready to
And
go.
can you tell if that piriformis pain is gone or is it still there?
It's gone. It's just from the pressure from the surgery, but I'm good to go.
Yeah, everybody has a little discomfort from the
Yeah,
surgery,
I
but
understand that,
you can
yeah.
tell the piriformis pain is gone.
Yes.
Congratulations. We
Yeah.
did it with minimally invasive, 4 millimeter little cut on the back of your hip there. And we just go in with our probe and we cut up the scar tissue that's, causing all the pain, release the muscle, and that causes the pain to go away right away. So what was life like for you before when you still had this horrible pain?
Very restrictive. I wasn't walking. PT, wasn't even helping. And the injections, that was ongoing with Dr. Patel for a while. But I hope to get back to life.
That's it.
No pain. That's the biggest thing. That takes too much out of you. It's not a way to live.
A life in pain is not good. Or
And I was
afraid of,
miserable. I was making everybody miserable.
or fear of pain, by doing something to set it off.
Yeah.
Now, the pain you had in your buttock, this piriformis pain, was it constant or did it kind of get worse with certain activity?
It got worse during the day. The more you did, and you just have to back off. I did ice and heat, and Dr. Patel did the injections, and it's just some, not immediate relief, but, I got some, but no, yesterday was a good thing.
Now, you're a dog lover, right? And you have a new puppy, you told me.
Yes, I have a little mini schnauzer, Darby. So
Darby.
now I can go with her. I can run and pick her up.
And that's it. Picking up is key because when you bend over to pick something up from the ground like a little dog, it usually aggravates the pain from the piriformis in the buttock. All right, so anything else you want to share with your viewers and fans out there?
Don't let it go. Get help, come to the clinic, and enjoy life now. I really will.
Congratulations, you took the leap of faith and you got it done. Go enjoy life.
Have a glass of wine on me.
Right. Sounds good. Let's get you out of here.